Hello, it's Dr. Watkins. Thank you for joining. I'm going to give everybody just a couple minutes. I just let everybody in. So I'm going to give you all just a few minutes and then I'll start the presentation. All right. So a lot of you are joining. Awesome. It's a good thing I did this virtual. See, we had snow today. It's freezing outside. You're at home in your cozies. It works out perfect. Okay. All right. Let me give you a couple more minutes to join. Okay. All right, ladies and gentlemen, we're going to go ahead and start. Yes, you raised your hand. Let me see if I can figure out how to do that. 1 second. Does that mean you can't hear me or something? 1 sec. It's always fun to figure these things out. A couple more minutes. 1 more minute. Just a lot of people still logging in. Give me 1 sec. I'll be right back. All right. Oh, Zoom. You always make things fun. Okay, so let's start because we have lots of people that are attending. So obviously, you know where you are. You're attending the virtual Sciton Laser event with me, Dr. Watkins. So we're going to talk about the new lasers that we have. Moxi, Hero BBL, Contour, Pro-Fractional. We're going to be talking about a lot of things. And I know there's some of you raising hands and asking questions. The way it'll work is at the end, we'll do a Q&A session where I will answer some of the questions that you all put. So if there's a question that you all want to ask, you can go ahead and do that. And at the very end, we'll do a live Q&A. All right. Okay. So what are we going to talk about? We're going to talk about reverse aging with all of the new Sciton lasers and the Halo that we already have, of course. That's our most popular laser, okay? And there's a reason. So make sure, again, like I mentioned, make sure you stay to the end, okay? You get rewarded to be at this virtual event. And at the end, we're going to do the Q&A session. So put your questions in there. The other thing is you get to find out what the promotion is and what the promo code is, okay? So you'll also find out how to get entered into the raffle for a free Hero BBL face treatment. Okay, so what did I bring in? Well, I went to the Sciton event, I don't know, 4 to 6 weeks ago. I guess it was right before open house. And so I did not think I was going to be buying anything because I already love my Sciton laser that has Hero and BBL and does all the modalities such as laser hair removal and pigmentation, etc. But we talked about the newer little sister of Halo, which is Moxi. And I'll tell you a little bit about why I wanted to bring that in here in a little bit. But I brought in Moxi BBL. It shipped on Friday, finally. And then the Contour TRL and the Pro-Fractional, which I'll be talking about, those that is not shipped yet, still in production, but I will be the one that's performing that. And my schedule's full until February anyway. So as soon as we bring that, trust me, you will know, but you can already come in for consultations for that. And that way we can get you on the schedule for when the laser arrives, because it'll be here in January. Okay, so why bring them in? New technology. Most of you know that I'm always interested in what's the newest thing, what's the best advanced treatment. And before I went, I really was looking at the Contour and Pro-Fractional. I didn't really realize that I was going to want the Hero BBL and the Moxi. I really thought it was maybe a baby halo, but it's not. It does so much more. So I wanted to expand some of the treatments that we offered, which we'll go over. I also wanted to reduce downtime and be able to treat all year with Moxi. That's huge. Laser season is what we talk about, and we're obviously in it all the way from September until sometimes, April or May, just depending on sun and travel. But with Moxi, you can really extend that all the way through the summer and through the entire year. And I think that's really important. And also to have very, very, very little downtime. So one of the biggies is that we have really advanced medical providers here at ANU at our 3 locations. And so I really wanted to bring in some additional exceptional treatments. And I also wanted to have a device at our Leawood location. Okay. So yes, that is where it's going. I know that's the big question. However, can you go down there for a Moxi once or twice or 4 times a year? Absolutely, positively. Okay, for all my Northlanders, and all of you that live down south are going to be very excited. And you can come up here if you need a if you need a halo or a contour. Okay, so I'll be the only one performing the Contour and Pro-Fractional, and that is at the North location. It goes on our current Jewel device, on our current halo device that we have. So another reason, right? We strive to be the best in Kansas City, but also the Midwest with cutting edge technology. And I really felt like this was going to bring in some of those modalities we didn't already have and really help our patients get to where they want to be with their aesthetic desires. So how are they different? You already have a halo. Why did you get a Moxi? Moxi, less downtime. Okay. I had mine at the event, and we had a cocktail party reception within 45 minutes, and I was there with makeup on. And was I pink? Yes, I get extremely pink and red. However, the next morning, I mean, really, you could not tell. Yes, it looked like I had a little bit of pinkness, maybe a little bit of a tan, but almost virtually zero downtime. And I can't say that about very many things. Okay. We can also now treat advanced melasma. This is really the sweet spot for Moxi, is really getting at that wavelength of light to really hit melasma, and also something that's safe for all skin types. Laser for a long time has been very limited to patients that have skin types 1, 2, and 3, being the lighter skin tones. Because in the past, lasers would cause hyperpigmentation. So after you treat somebody with heat or a laser with some other devices, it can cause that pigmentation to actually get worse. So we avoid those types of treatments in skin. This is different. So this really is that one device that's really going to set the stage for us being able to treat all patients of all types without exclusions. A lot of times, even with our halo and BBL that we've had for several years, the melasma and skin type 4, 5, 6 always take, some extra thought. What do we do for this patient? Now we don't have to do that. Okay. Now you are a Moxi patient if you fit into those 2 categories. Faster treatments, that is absolutely positively the case. Especially the BBL Hero, and I'll show you a video on that. So you can do a face Moxi and a BBL Hero on the face in under 15 minutes. At the event, mine was about 20 minutes, maybe 25. It was training session, and we did my face and my arms, where I have melasma on my arms. Okay, it's also great for the younger patients who aren't ready for halo and don't need halo. And also great for in between halos. So if you're going to get a halo every fall, this is something that you can do every spring or in between how you need, so that you can really get that glow and resurfacing, but not have any downtime. What's the Contour TRL? Contour TRL, I'm so excited about. I've been wanting this for quite a while. It is a erbium laser. So it is for deep lines and wrinkles with complete resurfacing. Okay, I'll show you some before and afters, but really we're talking about the lines around the mouth, the lines around the eyes, the etched in lines on the forehead, the cheeks, etc. And then the Pro-Fractional is for scars. So we can get excellent results with acne scars, also surgery scars, stitches, scars from sutures, etc. This is really a game changer, and I get a lot of consultations for scars, and I really find that not very many people have options to treat patients. We do have Morpheus, and we do PRP, and we do stem cells, and those are great options, but this is going to take that to a whole new level. And especially if we can synergistically combine some of these, the results that we get are pretty phenomenal. Okay, who's a good candidate for what I'm talking about? Hero BBL, everyone. Are you out in the sun ever? Every day. Okay, so there's really, truly not a patient who can't benefit from Hero BBL. The areas that have melasma, if you know what I'm talking about, the dark pigmentation that tends to be on that upper lip, that peripheral cheek, those dark patches, not spots. That's an area that we won't do Hero BBL. Everything else, Hero BBL is for. So your arms, your hands, your back, your shoulders, your chest, your neck, your face, anywhere that you have sun damage, the Hero BBL is going to help pull that brown pigmentation and that red pigmentation. It's called a photofacial. So everyone can benefit. Moxi, again, everyone. There's really not an exclusion to Moxi, right? So we talk about skin types 4 to 6. We talk about summer. We talk about all those things. Moxi is really for everyone all the time. Okay. Contour. We already spoke about this a little bit. So patients with those deep lines and wrinkles and laxity, focusing around the eyes, mouth, and cheeks. This is a procedure that has downtime. So that's definitely going to weigh into that. A lot of my patients also travel from far away. So they want a procedure that's one and done in a sense. Okay. The other thing is pro-fractional. Anyone with advanced texture issues, scars, acne scars, etc., is really going to benefit from pro-fractional. And we can also combine all of these modalities during a consultation. Halo. Everybody loves Halo. Again, best laser, hands down. Sciton makes the best lasers, and BBL Halo has been in our practice, like I mentioned, for several years. And if you haven't had it, you should. If you already have had it, you're probably listening, okay? Because you love Halo. Halo is a game changer for so many patients. It's really anti-aging. It changes the way our face and the structure, basically that pigmentation, right? So the pillars or the collagen and the foundation of the house, how do we support that? Things like fillers and toxin and threads, etc. How do we change the paint on the outside of the house? It's Halo BBL. Okay, so it's the gold standard for pigmentation, fine lines, tone, and texture. Still, in my book, the gold standard. Okay, however, why would you do Moxi, right? Because Halo, you have a little bit more downtime. Okay. You also cannot be in the sun for 2 weeks before or 2 weeks after, and that's very, very, very important. It's also not as good at melasma or dark skin tones, okay? However, you will get deeper and more results for certain patients. If you're under the age of 40 and you've taken great care of your skin, you probably don't need a halo, okay? If you're over 40, you've been exposed to a lot of sun, you're a beach person, you had a pool growing up, all of those things, you're probably a halo person, but we can absolutely tell that during a consultation, okay? Moxi. We talked about her. So it's resurfacing, fine lines, pigmentation, tone, and texture for that youthful appearance. It's really for that glow. Okay. The downtime is minimal. So makeup within an hour. All right. Over the next couple of days, you'll experience some redness, something called men's MENDS. So for the next 2 or 3 days, you'll actually get some of that red and brown that comes up to the surface. I worked through it. I covered it with makeup. You really could not notice it. Even on my arms, it was not very visible at all. All right. So minimal. Okay. So the Moxi, it's the approach to radiant skin. Okay, lighten, brighten, and refresh your skin. And we'll do some before and afters here in a second. So we have 3 settings for it. You can do a level 1, kind of like that glow facial, if you will, but obviously deeper because it's going to pull the pigment. That would be something where you could even go out that night, go to Invent. Okay, level 2, that's what I had when I did the Revitalize and Maintain. Really help that pigmentation, really maintain that skin that we work really hard at. The other one, level 3, transform and renew. So a little bit deeper settings, okay, a little bit more advanced settings for people that have more pigmentation, etc. I went with the 2 because I've had my Halo and BBL and I get them every year. So this was my maintenance. Okay, Moxi. So really going to be good for those patients that have that pigmentation. She doesn't necessarily, this patient, have a lot of spots, but what she has is that brown pigmentation that's very confluent. Another patient, this patient does have brown spots. This is Moxi and BBL. Okay, younger patient, right? Not those really, really deep etched in lines, etc. Another patient with that pigmentation on that lateral cheek. Forehead, right? So again, it's the paint, it's the resurfacing. There's a much brighter glow and reflection on her skin from the left to the right. That's what we're always looking for. This is a patient with skin type 5, really important because again, I mentioned that this is a patient we can now treat with Moxi, okay? And this is after one treatment. So imagine after multiple treatments, if that's what she desired, if she wanted to get some more lightening of her skin, she absolutely could. Another patient. This is a patient that could do either. This is a patient who I would say could either benefit from Moxi BBL or Halo BBL. It really depends on what she's trying to achieve. Halo will give her more texture changes, etc., but she did absolutely fantastic, and this result is great. Okay, this is getting Moxi. Don't mind my silly face. I don't know why I, just wasn't smiling or anything. Obviously, it's a treatment, but let's see if it'll play.
It's just a light roll. One pass.
No! I only checked this 400 times to make sure it would play. I will pull it up at the end.
Notice that
because this is not getting a Moxi. Very sad.
I stop, it'll turn blue.
All right, I will pull it up because I have it saved on my computer. Another one. This is me getting Moxi. We'll see if it plays. This is so heartbreaking. Okay, so obviously we can't see it, but literally what it does is that little ball, there's a roller. If you're going too fast, it'll be red. If you're not going too fast, it is green. And literally that's just gonna roll over your skin, extremely light. We don't really put any pressure on that, and we will just do it in the pattern in the area that we're trying to treat. Again, you can see up in that right upper corner, my face is pink and red. That's just me. I'm already red to begin with. But within an hour, like I said, I was at the cocktail party with makeup on. And one great thing about this treatment is that as compared to the Halo, you don't have to use Pronox, you don't have to use the Zimmer, a lot of those devices that are really required for that Sciton, the one that we have up north where it has to stay in that room. This is a machine that can move around. It doesn't have to have all the attachments with it. This is a great, easy device. Okay, Hero BBL. We'll see if this is going to work. Obviously, it might not. Super awesome. So I will pull this up. But here's the crazy thing about Hero BBL. It is so fast. And that's what I want to show you. So you can have face BBL done in literally 5 minutes. Okay. Yes, if you're doing some pigmentation or doing some other areas that are a little bit more advanced in the face, it might take more time. But to cover an area like a chest or the upper back, it is literally it's so fast. It's my favorite. So that really is one of the benefits of Hero BBL and Moxi. We block, quite a bit of time when we do a Halo BBL. With the Moxi Hero BBL, you can do a face and a neck and even a chest in under 45 minutes. Okay, what does that mean? That means for some of you, if you come to a consultation at our Leawood location, and if you already know you want it, you come for the consultation, that is possibly something we could even treat you same time, same day, if the laser's open, etc. Okay, so those are really some exciting things because we know a lot of people want to be treated here and now, if that's something they want. And this is the first time a device like that can really be done because it's so quick. We could numb you for 15 minutes, go ahead and do your procedure. When I did mine, I only numbed for 15 minutes, okay? Oh, you silly video. Okay, here are some body treatments. The body BBL, again, right? This is one treatment from left to right. That's pretty profound, okay? And I have a lot of redness. That's where I tend to be that flushed red, almost that rosacea. That's vascular issues, also from autoimmune for some patients. And so you can really get that brightening and that glow. More. This is what happens, right? A patient gets their face done, and if they don't get their neck and chest, trust me, all of you add your chest, and it's much more affordable to add it all at the same time. The other thing patients will do is they will do their neck and chest and face, and then they really realize that they want the shoulders done, they want the upper back done, they want the lower arm, they want the hand. So we offer all of those areas. Okay. Another patient, this is one treatment, right? She's got something called poikiloderma, which is where she's got the brown and the reds all over. That's a lot of sun damage on the chest. Okay. I would definitely, on this patient, do multiple treatments. This is after just one. So I absolutely, with patients with BBL, always recommend more than one treatment. But I think this shows you how, if you look, in between the areas, in between the lesions, how we can get rid of a lot of that confluence of the brown and the white. And then as we continue through that series, we can actually continue to pull up that brown and get rid of it, slough it off. Okay. That's a lot of sun damage on that patient's chest that has now been removed. And if you've been to any of my Halo BBL events, when I've spoken about, there's a study from Stanford with Hero BBL. And if this is a procedure that you have done every year, you can actually reverse age your skin. Okay, I think that's critical to understand. It's not just what we're doing superficial and how the skin looks, it's also what's happening at a deeper level, at the dermal level, the dermis. Okay, what's happening there is that skin is changing, and actually we're getting rid of that UVA, UVB damage. The number one cause of aging is sun. Okay, it's UVA, UVB. So if we can actually get rid of that damage, your skin can actually reverse age. And Stanford has studied this with this device for many, many, many years. Okay, so there's a really great study, and I'm happy to always show that to you. But if you've ever been to my other presentations, it is critical to understand that this is the number one thing that ages us. Okay, so you can take a patient and you can do a facelift, you can do a great surgery on a patient, but if you also don't change the paint and the texture and the age of the sun, the aging due to the sun, you're really not helping your patient as much as you could. Okay, I really, really focus on skin tone, texture. That's also a huge part of what aging, what makes us look aged versus anti-aging. Again, talking about patients who start to do their arms and start to do their legs. Okay. After one treatment on that patient. Back. This is one treatment. Obviously, I would recommend multiple treatments, but it's still a big change. Okay. Big, big change. Getting rid of all that pigmentation. Again, this is 3 treatments. Better results. Okay, so each time you get it, you absolutely get improved results. This is a male patient who had Moxi BBL. Great result for some of those brown spots, right? And also just look at the glow. Definitely that face has glow. You can look at texture, you can look at fine lines. There's other slides that show that better, but this is great treatment. And this gentleman had no downtime. Another patient. This is a patient I would definitely have that conversation with about doing halo or contour, just to help with some of the deep lines, the laxity. But if the patient wanted no downtime, absolutely Moxi BBL is a great option. If the patient cared about some of those deep lines and that laxity there around the mouth, right, and that cheek area, that's a patient I would definitely be talking about doing contour with. Okay. What to expect during treatment? You only need to numb 15 to 20 minutes for your Moxi. No need for pre-medications or Pronox. That's why we can do it right then, right? We don't have to make sure you have a pre-med. You don't need antibiotics or steroids or antivirals or Valium, etc. It's a warm treatment with minimal pain. I did it right there in the room, literally at the conference room with numbing for 15 minutes. You can possibly have it performed the same day if you're a good candidate, if based on the consultation, you're a good candidate for it and the laser's available, etc. Almost no downtime. We've already talked pretty extensively about that. Results in 1 to 2 weeks. And remember, it improves with multiple treatments, okay? And it's best to maintain every 3 to 6 months of melasma. Remember, ladies and gentlemen, with melasma, this is something we manage, okay? Same with acne. When you have melasma, every time you're exposed to the sun, UVA and UVB, that pigmentation, the melanin in your skin is becoming pigmented, again, hyperpigmented, more pigmented than the areas around it, okay? So I always tell patients with melasma, this is something you're going to maintain and manage. I recommend my patients with melasma, if you're going to do this, to get at least 2 treatments up front, and then to continue to do just your touch-up treatment. It's also more affordable, forgot to mention that. you're going to want to do a maintenance treatment every 3 to 6 months. And you're going to want to wear sunscreen every time your skin sees that UVA, UVB, it's going to pigment. Remember, we get reflection in our car, off the dashboard, walking, off the concrete. So sunscreen is important, even in the winter, even when you're not going to be outside, because you're always outside. Unless you live inside in a bubble, you are always exposed to UVA and UVB. This is how they overlap and how they are synergistic. This is a great slide. So this is your halo on the upper left, your BBL, either hero or regular BBL. They are the same. Heroes just can be done faster. And then Moxi at the bottom. So I always do combination treatments. I rarely ever, I really only recommend halo and Moxi by itself for skin type 4, 5, 6 and for melasma areas. Other than that, you need to do combination BBL with halo or BBL with Moxi to get your optimal results. Okay, so BBL, again, for your, mostly for me, it's going to be for that pigmentation, the brown spots, your redness, right? Those red spots, veins, sunspots. Halo and Moxi are going to be also for texture, rejuvenation, deeper pigmentation, help with pores. Okay, they're the glow. All right, so Moxi, yes, it's kind of called a baby halo, don't get me wrong, but remember that Moxi can treat those skin types and wavelengths that halo and BBL cannot. That's the added benefit. Okay, Pro-Fractional. So this is a procedure that I will be performing, and this is for your tone and texture, your fine lines, and your scars. All right, so this is a really big thing. Now, there is definitely downtime on the scar area, or if we're doing an area in the cheek for acne scars, that's a larger area, more downtime. It really depends on the type of scar and the area to be treated. If it's a small scar, right, on your face or on your arm or on your body, much less downtime, okay? This is a patient who had pro-fractional. And so he has a lot of lesions on his face. It's hard for me to know if those are AKs or SKs. I'm going to guess that there are a lot of actinic keratosis, which is actually precancerous. So this is a beautiful treatment to treat patients that have a lot of those lesions that other lasers are absolutely not going to get to. Okay, those raised lesions that halo and Moxi are not going to get to. Again, great for those acne scars. Okay, I cannot wait to use this on patients. Great example of a male patient, right there in that his right cheek. You're going to see that acne scarring and pitting. And what's great is not only does it help with the scarring, but it also helps enhance collagen. So it's going to appear as if not only did he have those scars removed, but it also looks like he had a little bit of filler placed in there. He did not. That is actually from the collagen building up from the bottom to help fill in those acne scars. Okay. Another patient, this male patient had a lot of texture issues. This is one treatment. So on him, I'd like to see multiple treatments. There's also something called rhinophyma, which is where the nose gets very large and bulbous and has a lot of vascular issues. It's actually a complication of rosacea. And this gentleman in this picture also has rosacea, and some of the complications of his texture are definitely from rosacea, okay? We see a lot of men like this. This is now something we can use to treat them. If they have those lesions on their nose or on their face or anywhere, those are things that I can now treat much more appropriately with a very, very advanced erbium laser. This just shows you texture changes and pore size. I think that's really important because so many people complain about pores. They can be treated with a lot of our modalities now. So it really depends on consultation, looking at the whole face. What are your ultimate goals, right? Because Moxi can help, halo can help, contour can help, and pro-fractional can help. Just depends how deep, downtime, goals. This is another patient who had pro-fractional, and you can see a lot of changes around that lower face. Lines, wrinkles, okay? Laxity, she's got that laxity. This is really gonna tighten that up. Kind of hard to see just because it's a white scar, but make sure you're looking near the eye. She has a snake pattern of a old scar, and that was after one treatment, okay? If it were me, I would, again, get the lesion right here. but that's after one treatment, and there's really not much that can do this for scars. This is great. Okay, so think about those scars for surgeries, whether that be a surgery that you didn't want, right? You had a fractured arm, or you were in a car wreck and you have something on your forehead or on your neck, somewhere on your face. The other thing are those surgeries that you did want, those elective operations, such as breast augmentations, tummy tucks, lipo, etc. This is such a great device, and it can just laser pinpoint those very specific areas. I can go very, very particular into one small spot, or again, I can do that whole cheek for acne scars. Okay, it allows me to be able to do what I need. Again, this patient, sorry if you're queasy, there's going to be some medical pictures here. This is a patient who had Mohs surgery. So she had surgery there because of a cancerous lesion. And unfortunately, we see more and more and more of these. Okay, so this is a modality that I can use to help treat patients so they don't have those scars, right? Pretty awesome. Another one. This was another cancer patient. You literally cannot see that that patient had a large portion of the nose removed in an elliptical excision, and then the cancer was removed by the dermatologist who does Mohs surgery, and then that was sutured by the Mohs surgeon. This is great that now I can see these patients after they've had these Mohs surgeries to remove cancer and really help them. Another one. Okay. Another one. Again, this is another cancer patient. Okay. So again, we see more and more and more because basal cells have to be cut out, squamous have to be cut out, and obviously melanoma have to be cut out. Okay. But to be really anxious and nervous, knowing that you need to have this operation and know that, you know, in several months you're at stage 2, the middle picture, knowing that one of these devices can get you to the last picture on the right, that's pretty phenomenal. Another cancer patient. Another. Actually, I take that back. This might have been a accident in the emergency room, but this is essentially what was able to be done, which is awesome. This is also pro-fractional for acne. Okay, pretty great result for this patient. Would I continue and do more? Likely, I would. If the patient wanted me to work on scars more, I absolutely would. But this patient is extremely happy when they can go from the left side to the right side. That's a big, big difference. Okay, pigmentation and acne and scars really change a patient's confidence, and I'm just really excited to bring this. Contour TRL, the one I've wanted for a long time. Okay. I didn't even really know I wanted the pro-fractional until I went to this conference, but I do love to treat scars. So I really like helping patients that have scars that really bother them, and you can remove them. It can be pretty life-changing for a patient. So Contour TRL, erbium laser. It removes lines and deep wrinkles, including those lines around the lips and eyes. And I've had a lot of patients that I've consulted in the last couple of months that I've been seeing for a long time. And we've done Botox, and we've done fillers, and we've done ThermiSmooth, and we've done Morpheus and Vivace and PRP. We've done every option we have for around those eyes, but they really just have those deep wrinkles around the eyes. And that's the thing that just really, really bothers them. Those of you who I've invited to listen to this is the one. Okay, this is the contour. Also, those deep rhytids, medical term, or lines that are etched in around the mouth. Yes, we can do filler there. Yes, we can do toxin. There's a lot of things we can do. But the beautiful thing about this device is it's one and done. Do you have downtime? Yes, absolutely. It's 2 weeks of the area treated. Okay, 1 to 2 weeks. However, most of my patients that I've consulted with, they're extremely excited about this because they don't have to keep coming in every 6 weeks for another treatment and another treatment. It's one treatment. Okay. Is it worth the downtime when I talk to them? Absolutely. Because again, they don't have to keep coming in for multiple treatments. All right. So this is definitely based on consultation, knowing the expectation for the downtime, but also knowing the expectation that your results are going to be phenomenal and be a lot different than some of the other things that we have. Okay. Need I say more? This is one. Okay. Yes, I say one and done. Obviously, some patients are going to want another one, or maybe hyper focused around some of those areas, you know, around the eyes or somewhere else, but there is downtime associated with this again. However, This is one treatment. Okay. That's why I brought it in. Game changer. One treatment, right? Complete resurfacing, lines and wrinkles, almost completely gone. She does obviously still have some of those lines and rhytids around that left eye. However, she has a brow lift. I mean, she literally, I can't even tell you how many years this took off of her, right? You can see for yourself. Nice and glowy, much tighter skin, much less wrinkly. So those of you who have worshiped the sun, right? And now have wrinkles, whether they're premature or appropriate for your age, this is the laser for you. Those perioral rhytids, one treatment. Okay. Versus this patient having to get Botox every 3 months in this area, having to get filler every 6 to 12 months. Maybe she doesn't want filler. She doesn't want her lips to be any bigger. Okay. Obviously, we can do synergistic. I can do Botox and I can do filler to enhance and contour the lips. But if the patient really doesn't want any of those modalities and just wants to remove those lines around the mouth, this is it. Okay. What can I do if I do some combination treatments? This is after one treatment. Okay. So this would be a patient up until now that came into my practice that, yes, we would do Morpheus. Yes, I would do some PRP. Yes, I have a lot of options I could offer. However, can I get this results with one treatment? No, this will be the first time I'll be able to offer a patient like this, something where I know within a couple of weeks, this is the result that they're going to have. Okay. Another patient, right, with that deep acne scarring that we call it, the ice pick marks. Again, patients are really affected by this. It really bothers them, and this is such a great option. This is a patient who had a combination. She had contour, whole face, and then they did pro-fractional, came in again around the eyes, right, and a little bit around the mouth. One treatment. I'm so excited. Did I tell you that? Another patient, actually, same patient. I cannot wait. Another patient. She might want another treatment, right? She might want me to come in and do a secondary treatment with a pro-fractional right here or around those eyes. But I'll tell you what, that's a fantastic result. And this patient has reverse aged for sure with one treatment. Another gentleman has a lot of scarring in the cheeks. Looks like he got filler. He did not. That's the amount of collagen enhancement you can get with an erbium laser. Need I say more? I bought it for this reason. I see these patients every day. Okay, my patients are aging with me. I've been injecting and doing this for 12 years now. So my patients are all aging with me. And as we age, these rhytids really start to bother us, these lines. So I'm excited to offer a new thing. Again, this patient, right? Not only did it help with collagen and tightening, etc., but a lot of this for her is that sun damage. Okay. And some of these lesions are going to be raised. They're going to be seborrheic keratosis and actinic keratosis, things that BBL or Moxi or Halo can't quite get to. So this is a more advanced laser for a patient that really has a lot of that sun damage and precancerous lesions. Okay. What happens during these procedures? What goes on? Well, I'm trying to show you a video, but yeah. Your skin will be cleansed. Eyes are protected with safety shields. Basically what we do is we move that laser in the designated treatment area. Okay. So whether it be Moxi, whether it be Halo, whether it be contour, pro-fractional, very, very specific lasers, extremely smart, the best on the market. Okay. So procedures, depending on what we're going to do, depends on how big the area treated, right? If we're just doing face, if we're doing face, neck, chest, if I'm going to do a small scar, if I'm going to do a large area, all of that matters. And that'll be based on consultation. Okay. Will it be uncomfortable? Totally varies patient to patient. I will tell you right now, I can do Botox on 10 people and 9 of them are fine and 1 is not. Filler, same thing. Thread, same thing. Halo, same thing. Okay. So it really varies from patient to patient. Also varies on how deep of a treatment we do. And that will vary on how much texture problems you have, scars, etc. Okay. How, I don't want to say the word aggressive, but how appropriately are we treating you for the issues that you have? Okay. Shallow treatments, it's very well tolerated with topical anesthetic, right? So that's going to be your Moxi, your BBL. You don't need any anesthetic. With your Moxi and your Halo, you're definitely going to do just a topical lidocaine. And at your pre-laser appointment, we give that to you and you actually come in numb. So you haven't wasted that hour here in the office. You just come in ready. For the deeper treatments, I might inject a local anesthetic, right? A little bit of lidocaine injected. Totally depends on the treatment. Okay. How long will it take to recover? Again, depends, right? Depends on the depth of the treatment, what your issues are. However, if we're talking BBL, really, you're going to have that brown is going to pepper. We call it pepper, right? It'll get a little bit darker. In a couple of days, it'll slough off, right? Is anybody really going to notice? No, might look like you have a little bit darker freckles or darker brown spots. That's it. When it comes to Moxi, you know, like I told you, I was at the event that night. I was at the event the next day. Halo depends on you. Depends how deep we go. Anywhere from 2 to 7 days, depending on if you're a sweller. If you are somebody who swells, you'll have more downtime. If we have to be more deeper with our treatment around the eyes, etc., a little bit more downtime. If we're going to do something like contour, where literally I erase the lines and those issues from your face, I say 2 weeks. Okay. And when I say 2 weeks, that means you're not going outside, you're not going to the sun, definitely for 1 week. But I'm going to advise my patients that they really stay out of areas for 2 weeks. Okay. So try not to leave the house, etc. It's all about just appropriate skincare. That's really the only thing. As long as you follow recommendations and do skincare, no worries. Okay. What about pre-care and aftercare? Again, consultation. I know lasers, consults are where it's at. So absolutely, we're going to ask that you always avoid any sun exposure before a laser and after a laser. And all of these Scitons are included when I say that. Okay. So a lot of our recommendations when we talk about post-care, it's like, oh, avoid sun for 2 weeks, avoid sun for 4 weeks, avoid sun for whatever. I will tell you right now that the more you avoid sun the rest of your life, the better. Okay. That means sunscreen all the time. I really say 2 weeks before and after a halo, you are not in the sun at all. All right. After that, you can be in the sun, but I still always want you to be using sunscreen, a hat, clothing that is protective. Okay. You need to protect your investment. If you spend this kind of money to have a halo, BBL, contour, whatever it is, even if it's Botox fillers, right? Remember, what do I always say? Protect your investment. Okay. You spent a lot of money and a lot of time to get these things done. What's the number one cause of aging? Sun. What's the number one cause of pigmentation? Sun. Number one cause of wrinkles? Sun. Number one cause of laxity? Sun. Okay. All right. Recap. Types of Sciton laser treatments, the BBL, because I know we talked about a lot of things again. So going back to kind of that 3 diagram picture. BBLs for sun damage, blood vessels, and brown spots. Moxi, melasma, texture, uneven skin tone, prejuvenation, and year-round treatments. These are going in the order of depth and downtime too, okay? Halo, pigmentation and texture issues, right? I would say definitely Halo still that gold standard if you're over 40, 45, but that doesn't mean you can't benefit from Moxi and BBL. Absolutely. Pro-Fractional, those wrinkles and scars, okay? And then contour, complete resurfacing. And you saw the results, why I call it that. Okay. All right, don't leave yet. I do have some questions that I will answer. The other thing is, how do you get your promo code, right? And how do you get entered into the raffle? Isn't that what we all want to know? Isn't that why we all stayed here? So you're going to get emailed the promo code tomorrow if you are on this presentation still. Zoom is smart, I know. So Make sure you stay till the end. You also will get in that email tomorrow with the promo code, you're going to get a link to a survey. Okay. If you complete the survey within 48 hours, I will add you to the raffle for the free Hero BBL face treatment. Okay. And then we will announce the winner Friday. So if you can get the survey in by the end of Thursday, it'll be emailed to you tomorrow, and you have 48 hours to get it in. So that way Friday, I can let you guys know on social media who won the free treatment. I know there's work to be done. I'm sorry. All right. So what's the promo? Okay. So remember, I think everything should be a combination treatment. Moxi with BBL. Okay. So if you purchase the package of 2 Moxis and BBL, you're going to get a Hero BBL for free. Okay. That's huge because remember, I want you maintaining this. Okay. So essentially what you're going to get is you're going to get a maintenance treatment for free. And I think that's important. Protect your investment. Getting rid of pigmentation is not one and done. You definitely want to do your BBL Moxi or BBL Halo at least once a year, if not more. Okay. The first time you're getting this done, you definitely need to do at least 2. Yes, we sell them in 1. I don't recommend it. You're going to save a lot of money buying it in a package of 2. The other thing I always tell patients, if you've been to my laser events, is always buy the areas you think you want to do all at once. We bundle them. Okay. So we bundle face and neck. We bundle face, neck, and chest all together. You will definitely save more if you do them all at the same time rather than doing face, loving it, right? Then 6 months later, you want to do chest. You're going to save it to bundle it because you're in that room with that provider. You're already numb. You're already using a tip. You're already using the laser. Okay. Plus now with the Moxi, it doesn't take as much longer to add those areas. This also can be something that in the middle of the treatment, probably for the first time, we can actually say, yes, I might be able to add that chest and neck that you want. Okay. So maybe one of the providers is treating your face and you say, you know what? I do want chest now that we're doing this and it's not that bad and I can handle it, because you will be able to. Let's go ahead and do the chest. That is something that we could add on because this treatment is so fast, all right? But I always say, especially for a promo, always buy the most you think you're gonna do, because what happens is you'll have this line right here. I see it all the time. You have that collarbone line and you needed your chest done, okay? Where does your face end, ladies and gentlemen, if you're a patient of mine? Here, skincare product. And remember, laser, all of this is your face. Okay. If you purchase a package of 4 Moxi Hero combo treatments, which is going to be an even better savings off the get-go, you're going to get a Moxi BBL for free for maintenance. If you are a member, you will also get 10% off of either one of these packages. Okay. Yes, these treatments are definitely cheaper than the Halo. Why? I really haven't figured that out because it's a new laser. It costs just as much, but one good thing, reduced treatment times. Okay. So we're able to treat more patients in a day, but you're still getting the most advanced laser there is. Okay. All right. Contour Pro-Fractional promo, 10% on any of those. Or if you're a VIP member, 20% discount, right? Based on a consultation. So that will be a very big discount for our patients. It's all going to come down to consultation. If you've already had a consultation with one of us and you already know that you want Moxi BBL package of 2, absolutely. We can go ahead and do that. You don't have to have a consultation if you've already had a consultation with your medical provider and they've already told you there's going to be this event. After the event, you should buy. Okay. More promo information. Anybody who attended is going to get the email tomorrow with the code. Got to mention the code to get the promo. And then you have until the end of January to purchase the promo. I've never really extended it that long, but I know this being a newer device, and I'm also bringing in some more advanced lasers with the Contour and Pro-Fractional, I want you to be able to have a consultation if you need one. All right. So if you need a consultation, we've added Thursday, January 5th for myself. And because I'm booked all the way till February already. So I opened up a day to be able to do team consults. And that will be me with 2 providers doing your consultations for you. If you can't come that day, you can come any day after that. So any day from January 5th until January 31st to have your consultation and make your purchase. Okay. Extending it. Okay. So thank you for joining. I'm going to see if I can find those videos. If not, actually what I can do is go ahead and send them and the link. I can go in and update that where you can see the videos. Hopefully I can add those because the basically what I'm showing you is it is so quick and it is essentially painless. Is there some heat and warmth? Yes, absolutely. It's Moxi. Was it intolerable? No, I mean, literally it was a 15-minute treatment. My face was warm for about an hour. I used a mask. I didn't have spray. I didn't have Pronox, no medications. I didn't have the water thermal spray, none of it. Okay. I didn't even have post-care. I had some of my own, but they didn't provide it. So I did a mask that really brought in moisture and helped cool the area. You can also do ice packs. You can do a lot of things. Do you have to? No, not with Moxi. Okay. So let me see what questions we have. Okay. What's the difference between BBL Hero and BBL? They are essentially the same. The difference is that BBL Hero is faster. Truly, that's the difference. Okay, we can just do areas that are a lot larger in less amount of time. Right? Best treatment for the body, arms, legs, chest, for elasticity and texture. I wish I could answer that with one fell swoop. However, it really depends on you. I did my forearms. I did those with Moxi. That's because it's melasma. For elasticity and texture, usually for those, even though I can't see, what in particular this patient is asking, I would say that that's probably going to be Morpheus, but I absolutely would have to see what that is. But does Morpheus help tighten the body? It's my favorite for the body. Okay, that's radio frequency microneedling. It's a very advanced RF microneedle device that we have, and that's great for body, for contour, for dimpling, for tightening, for little fatty pockets, for cellulite, etc. Okay, what do I recommend for a couple brown spots on the hand that BBL has not been successful in the past? I would want to see if those are raised lesions. I would want to know if they're, more of a seborrheic keratosis. So it might be something like cryo, where I can freeze that lesion off in the office, or that would probably be the pro-fractional, where I'm just doing a small little spot treatment. And another cool thing about the pro-fractional and the contour, which I didn't mention, is that the provider, medical provider, one of the other nurse practitioners, nurses, etc., can do your BBL, and Moxi or BBL Halo would be more appropriate usually. And then I can come in at the end of that appointment while you're already there and go ahead and do your pro-fractional or your contour. Okay, that's what most of these treatments are. If we're doing full face and you don't really need all that peripheral downtime for the contour, we're going to do Halo BBL, and then I'm going to come in and I'm going to focus on that area where you really need it. Okay, where you need that contour or pro-fractional for a small area. Is Moxi available now? No, I wish it was. It just shipped. So we will start, just also because everybody's already booked, right, for the next couple of weeks because we're in the holidays. So starting January 5th, we'll do consults. January 5th is consultation day for me, and I'm going to do that with my other medical providers in conjunction. And then after that, anytime from January 5th and on, you can do it. If you already know that you want it, that could be different. We might be able to get you in sooner if you've already had a consultation. Okay, so discuss that with your medical provider or shoot me an email. Any other questions? Let's see. How does contour compare to and differ from Morpheus? Based on the photos, literally it is, how do I say this without saying face off? That's kind of what I would say. It's probably what I would say to my patient. Contour really does erase those lines. Okay. So if you're not trying to do fat ablation, meaning you don't have these big heavy jowls, you don't have this big heaviness right here, and that's not your area of concern, and it's mostly wrinkles and tightening, that's a patient I'm probably going to start pushing towards contour. Okay. Main concern, large pores. Do I recommend the Hero treatment or microneedling? Good question. that is really depends on if you also have pigmentation issues, okay? Because if you have large pores, you definitely need some heat with that. So that's either going to be radio frequency microneedling, if you just have fine lines, pores, texture, or that's going to be your halo. Now, if you have a lot of pigmentation, brown, red, I'm going to say that you're going to want a halo with that because you're going to be able to treat all of those issues with one modality. All right. What if you have white spots instead of brown? Here's the bad news about white spots. White spots cannot be removed. Okay. They can't be removed by a laser because a laser actually picks up the pigmentation. It finds the brown and it finds the red, and that is actually what's removed. So the wavelength of the laser is what detects that. Okay. It can't detect white. However, there was a picture in there that I said was poikiloderma. Poikiloderma is where the chest, the arms, etc., have almost like that tannish brown appearance with white speckling. Okay, so what we can do is actually use our lasers with that because you can actually remove the brown. Okay, so I can't remove the white, but I can definitely help to remove the brown. And then your skin tone is more even, if that makes sense. So I can't make that hypopigmented area become pigmented. So I can't take white and turn it to tan or brown. But I can take those darker areas and polish them, if you will, in a sense, and give them that shine, that glow to help match the white so that your skin tone is much more even. Okay. Let's see, another couple questions. Does contour TRL work well on necklace lines on the neck? Here's the thing about the neck and the body. They do not heal the way the face does, okay? So I will absolutely do anything on the face. There will, depend. Some people will be candidates for those necklace lines with the Pro-Fractional or with my erbium handpiece, and some will not. It'll really depend on healing, amount of wrinkles, etc. But it could be an option. I would just tell you that contour is not something that we're going to do on that entire neck, just because it would take the neck a long, long time to heal. It doesn't have the same epidermis and dermis, meaning, it doesn't have the same blood vessel property, nerve property. So this heals much faster than this. There's literally like a demarcation right here. If you were to do a skin biopsy of the face versus the neck, these are very different tissues. It doesn't seem like they are, but they are quite different, and they're quite different in the way that they heal. Okay. I have a BBL scheduled. Could I do a consultation to see if we can change? Absolutely. And actually, a lot of times we can just, if you email us, we can look at your pictures and tell you. Okay. What does it take to become a VIP member? Okay, so VIPs, those are our members. I still call it Lux. I know, ladies and gentlemen, we have like 800 members. It is actually the VIP Glow membership. And if you are a member, you get 10% off of things. And usually when we do events, you get an additional, sometimes 20% off. Okay, so you always get the better deal. To become a member, it is $150 a month. However, you keep $125 of that in your spa bank. Okay, so basically it's a savings account here for you at Anu. It accumulates. So that $125 a month is yours to use whenever you want. Some people save it up all year for open house. Some people use it every 3 months when they come for Botox. So let's say you haven't been in 3 months, you're a member, you already have $375 left in your spa bank or your savings account. You come to get Botox, doesn't hurt so bad. You've already got $375 in there. You get 10% off your Botox and you get a free treatment every month. So some examples of that: turbo shot, a glutathione shot, LED light, infrared sauna, facial, glow peel. I know there's quite a list. And so if you want to, you can go to our website. And there's a link. You'll click on patients, and then under that it'll say members, and you can click on that membership link, and now you can become a member online. Awesome. Okay. All right. So, average cost of each treatment without a discount. Very wide range, but nothing is over. I don't think I have anything over $4,000 of anything we talked about. Okay. And for Moxi and BBL, that's a combo package. But what we can do, if you all would like, is I can also get you that pricing information. I'm happy to do that. Okay. One patient recovery. Recovery totally depends on which procedure we talked about. There's 4 different lasers that we talked about, and I can answer that off to the side. Best pain medication for contour. So for medication for contour, usually we'll do Valium, we'll do something, then we will definitely do topical, and we might even inject some numbing medication to those areas. And what's the best for skin tightening? Totally depends. Again, totally depends on the patient and what kind of skin tightening and laxity in the area. Also depends on if you have any of that fat that needs ablated. Morpheus is great at fat ablation, tightening, lines and wrinkles. Contour is going to be more downtime, but you're going to do one treatment to see those significant results. So they're definitely different. Okay. Which location is the consultation January 5th? That's going to be at Leawood all day. Okay. So if that's something you want to get booked for, ASAP, because it'll book. I think I already have 2 consults booked. Okay. And they're an hour. All right. Thank you. Helpful. You're welcome. I love to teach. Dark circles under the eyes. Oh, I know. It's still such a thing. Dark circles under the eyes. Consultation. But I hate to always say that, but it's true. It depends on if you have laxity and you have puffiness, or it depends on if you have hollowness or concavity. Hollowness and concavity can be treated sometimes with filler, almost always with PRP, right? Because PRP is going to help thicken that skin, give you that collagen, really help those under eye wrinkles and that darkness, because a lot of that darkness either comes from pigmentation. If it's from pigmentation, that's where your Moxi comes in. If it's not due to pigmentation, it's due to thinning of the skin where the blood vessels are more apparent under the eyes. That's where something that helps thicken that skin with collagen, such as PRP, is going to help. Okay. Absolutely. If you have dark skin under the eyes and it's a pigment issue, you must use something for pigmentation, whether that's a hydroquinone, retinol, sunscreen, all of them. Okay. Do the treatments affect fillers or threads? No, they're all synergistic. Do them all. Okay. I know, I wish some of these things, it's like, you don't need this, this replaces that. Unfortunately, or fortunately, because we have so many modalities now, it really benefits patients to do combination treatments. Okay. What if you have KP? I'm assuming you mean by KP keratosis pilaris, those bumps on the back of your arm. I would want to see that, but I will tell you from the functional medicine doctor point of view, that is not a skin issue. That is a gluten or dairy intolerance and a sensitivity. So avoid those first before you pay for laser. All right. And then somebody's asking, I have a package of Halo BBL that I had purchased, but I haven't scheduled, but now I'm thinking I might want pro-fractional or contour. It's totally possible. And actually probably what you're going to want is you're still going to want the Halo BBL. And then you're going to want me to come in and add either the pro-fractional or contour over that to a certain area. Consultation, absolutely. Can we apply that? You bet. Okay. So email info@anewaesthetics.com. Anything my front desk can't field, trust me, they're going to shoot it right over to me. Okay. The next 2 days I'm swamped in the office. So don't be mad at me if I don't get back to you in the next couple of days, but I will. You guys all know I do get back to you as soon as I can. All right. Thank you. Thank you. Thank you. Thank you. I love questions. It always helps because I know if you have that question, all these other people have it. And we had a lot of participants tonight. So thank you. I will definitely update the email that's going out tomorrow and add some more things, maybe some video, maybe some pricing, maybe some things. If you have other ideas that you want me to add, you can put it right here. Okay. Everybody have a beautiful night. Don't freeze. And please stay safe this week with all the cold. Do you still need sunscreen? Yes, please wear your sunscreen. Okay. Ciao.